Let me know when we are good.
We are good.
Excellent. All right. Good afternoon, everyone. It is a pleasure to be back. Hopefully everyone had a bit of a outdoor, socially or physically distanced weekend outside of the little rainstorms that happened. So we are nearing the end of session here, our second to last vaccine work group meeting before the end of session. Appreciate the acting secretary being with us every Monday. It has been a starter of the week. It's the way we start it's like the frame of the week because the most important thing around vaccines. We do have a hard stop today at 4:45. So we're going to be a little bit more condensed than we normally would. We have executive nominations at 5. So we're going to leave a little bit of a buffer between then, and we will jump right in. I will say overall, good numbers in terms of aggregate vaccines. It looks like out week by week. I was glad to join the acting secretary at Sacred Heart in my district for a site that is a community-based site in partnership with Hopkins and Build and a number of other community organizations. A lot of really interesting takeaways for me personally, and was really amazed by the amount of person power that was needed just to run a single community site. So that was something that certainly was eye-opening, but there was a line out the door. People were ready and willing to go. There was a great translation crew that was helping to navigate, and got to see all the complicated factors of trying to make sure that a site is accessible and open. And there was just clearly a lot of trust based in the community that had been a testing site. So I wanted to sort of reflect on that because it was a really eye-opening experience. So we will jump right in. This is also a big day. March 29th was the date of hopefully supply increase. So we look forward to hearing about that. Without further ado, I'm going to hand it over. In the order today, we're going to start with Senators Lamb and Washington, who will have to leave because they have to get into a voting session. And then we'll have Senators Young, Eckert, and Rosapep, and we will be out by 4:45 at the very tip latest. So without further ado, Mr. Powell, if you could take it away with the overview.
Sure. Thank you, Mr. President and work group. I'll be quick. As we all know, the positivity rate for COVID in the state is much lower than it was before we had vaccines available, but it's been climbing for about 3.5 weeks. It's over 50% higher than it was on March 3rd. Just wanted to note that. I think that's being experienced across the country. We were able to put recent COVID cases since March 3rd on a map by zip code. I wouldn't read too much into one particular zip code, but I would kind of note some general areas where there, are COVID cases. At least 1 in 200 people in that zip code has caught COVID in the last 3.5 weeks. You see Eastern Baltimore County, Baltimore City, parts of Prince George's County are notable. Next slide, please. So we took a look at COVID case rates by age cohort and how that compares to before we had vaccinations available. And what's interesting, and I think by design, is that those over 80 and those over 70 have seen the greatest decrease in their case rates since vaccinations became available, and 60-year-olds are right behind them. And the least decrease in rates has been children, 0 to 9 and 10 to 19. And I'll also note that all ages seem to be trending up slightly in the last couple weeks. Next slide, please. Vaccines administered, it continues to climb at about the same rate it has since we began doing this. Next one, please. So we're looking at the positivity rate and the death rate. The death rate remains kind of low as the positivity rate has increased a little bit over the last 3.5 weeks. However, we know that COVID deaths usually lag new cases by about 3 or 4 weeks. And so we'll continue to monitor that. The hope is that the death rate stays low, even if the case rate goes up, because the vaccines are getting to the right people. Next slide. This is the same thing, but for hospitalizations. As you can see, hospitalizations have actually increased over the last week or so. Next slide, please. This is how Maryland compares to the other states. I believe we are 20th in first doses and 29th in percentage of our population that's been fully vaccinated. This used to be first and second doses. Now it's first doses and fully vaccinated because we want to include the J&J vaccines in our analysis. Next one, please. So this is daily vaccination rate by race. You can see white Marylanders are the gray line at the top, being continuing to be vaccinated at a much higher rate than other races. And the next slide, Jake, is the same thing, but for ethnicity. And the top line is non-Hispanic or Latino Marylanders. The blue line is Hispanic or Latino Marylanders. Obviously quite a gap there in the daily vaccination rates. Next one, please. So we introduced this last week, and I think it's important. This, moving from left to right, is the cumulative vaccination rate for 70-year-olds in the state. So we're up to about 70% of them have been vaccinated. But the other axis on this is the daily vaccination rate, and that is, I think plummeting is a fair word for that. I think at this point, if for some reason it was to flatten out and stay at about 0.5% per day getting vaccinated, it would take something about 40 days to get from 70% to 90%. But again, it's hard to look at this and think that for some reason that's going to reverse course without some kind of intervention. Next one. Same thing, but for 80-year-olds, again, rapidly declining daily vaccination rate, as presumably the ones that were eager to get a vaccine got it, and now it's people who are a little bit more difficult to reach or maybe reluctant. Next one, please. 8 largest counties in Maryland. This is the vaccination rate. It looks kind of clustered together, but I do want to point out that those counties with the highest rates are, their vaccination rate's about 50% higher than those ones with a lower rate. So that, and then you compound that over time, and it does increase some disparities. Next slide, please. These are the cumulative rates for those 8 counties. I have the data on the other 16 counties if anyone's interested. Just point out that Prince George's and Baltimore City are the 2 that sort of stand out as lower percent of vaccination compared to their percent of Maryland's population. Next one. Finally, this is the last one I'll show. This is vaccination rates by zip code as of March 18th, which is the last time we asked for data and got it on this. Again, I wouldn't look too closely at any individual zip code, but you can see some areas where the vaccination rate is low. Those are red. So part of the inner ring of Prince George's County. Baltimore's hard to see on here, but areas of East and West Baltimore in particular. And then you can see some areas that have been vaccinated at 30%, even over 40%. As well. Mr. President, that's all I have. Thanks. I'm here if you have any questions.
Thank you, Mr. Fallon. I know that was quick. Appreciate you, the brevity, but certainly rich with information. Onwards to Acting Secretary Schroeder.
Okay, can you hear me, Mr. President?
We can.
Great. If we could have the first slide, I'm gonna move through this quickly. You've already covered this, Mr. President, so I won't spend much time. The only thing I wanted to point out, this is part of an effort that we're doing with the Convention Center, targeted at zip codes 21205, 13, 18, and 21224. So next slide, please. Last Thursday, we opened the latest mass vac site at Hagerstown Premium Outlets. I was there with the governor and General Burkhead. We anticipate to ramp this up rapidly to approximately 12,000 vaccinations a week, and it was a very good startup. Next slide. This is something that I wanted to emphasize. Last week we were at COPPIN State University. I was with President Anthony Jenkins and the Convention Center Field Hospital, and we've been working on this targeting of zip codes in Baltimore. They had local residents staffing the call center and were calling in to 21215, 21216, and 21217. From there, we went to the Convention Center where I met Baltimore City residents, and they did 2,700 that day. And through the interventions that we've made over the last 2 weeks, 3 weeks, we're getting now very high percentages of Baltimore City residents at the Convention Center with the target towards those zip codes I mentioned. The one thing that the COPPIN is doing along with the other partners is they are sending out flyers, and they have a phone number 443-462-5511, and they're calling in and bringing people to the convention center, and that's available at umms.org/BCC vaccine for an appointment. So we're very happy with the effort there, and I want to thank our partners at Coppin State, New Psalmist Baptist Church, and UMS for the work they've done so far. And of course, as you mentioned earlier, Johns Hopkins is helping us on the east side. So we're making good progress there. Next slide, please. We've talked about vaccinating residents 65 and over, and I wanted to show this data so that we start to get a baseline. As I've said before, this is one of my top priorities. This is the first thing I look at early in the morning. As of yesterday, and we have an update today, but there's about 3,200 that were done yesterday on Sunday. But as of yesterday, there were about 663,000 Marylanders 65 and over that received their first dose, and nearly about 395,000 have been fully vaccinated. That leaves about 295,000 still to vaccinate. The CDC says that we are about 3 or 4 points higher than this. What we are doing, we're showing the 295. Based on the CDC data, there's probably been another 40 or 50,000 vaccinated, but they're outside of the state. And what we're doing is trying to get the CDC to share with us who those people are, so that we can get that data into our Immunet system, which we don't have. So if it is another 40 to 50,000, as CDC says, that means we're down around 250,000. We have a multi-pronged strategy that we're executing to push vaccinations out where we can pull them into places where we can vaccinate people. We began vaccinating 75 and older in mid-January and included 65 and older a week later. It's taken us about 105 days to vaccinate the 663,000 seniors, or about 70%. And as Mr. Powell observed, our next step is to vaccinate at least 35,000 seniors a week by pulling them into vaccination appointments. And that's going to be a very focused ground game. If we go to the next slide, please. We continue to reach new vaccination milestones. Over the weekend, we went over 2.5 million. Our 7-day daily average is now more than 49,000. Last week, we entered phase 2, and the coming weeks we'll enter phase 3, so that all Marylanders 16 and older are eligible to be vaccinated by the end of April. We've opened more than 475 sites across the state, including the 6 mass vac sites, operating 7 days a week, and we're adding an additional 6 sites that are set to open by the end of April. Among them, we've got 90 primary care practices that are targeted. I mentioned last week that we had 37 practices that we selected based on their connection largely to African American and Hispanic communities and areas with less geographic access. The additional 50 that we added this week fit that criteria, but also are targeted at 65 and older populations. And as I mentioned last week, throughout phase 2, our primary care practices were going to focus on vaccinating those with underlying medical conditions that increase risk for severe COVID-19 illness, such as the elderly we are targeting. So in conclusion, we're expanding capacity, access, and we're reaching deeper into the communities to vaccinate our 65 and older population, which remains a top priority. And I assure you that we will not leave anyone behind. Senators, I look forward to your questions.
Thank you very much, Mr. Acting Secretary. And just to remind folks, we're going to have Senator Lamb, Senator Washington, Young, Eckert, Rosapap, and Senator Lamb and Washington will have to jump when they conclude. Thank you sort of baseline question, March 29th was this date. Are we seeing that increase come as expected or anticipated?
It began this week. We've got another 34,000 plus J&J that's been ordered and will be distributed. And we got a little more Pfizer. So this week we're seeing about a 50,000 dose increase. And of course, on Tuesday, we'll get the next, what do you call it, projection. And then we're working with the federal government. The projections for J&J have been coming on Thursday. So either Tuesday, hopefully we'll get the Pfizer and Moderna. We hope to know by Thursday the overall, and we expect more. But at a minimum, we've got another 50,000. So we're hopeful.
And so right now it looked like when I was talking to Mr. Powell before that we have roughly 150,000 delivered, ready to go out. And of course, the timing of the day of the week always changes. Do you feel confident that we will have moving forward 50,000 doses administered per day?
Absolutely. Yeah, we're gonna be ramping up. We have a lot of capacity that we can increase. For example, moving more doses to primary care docs, moving more doses to the mass vac sites, moving more doses to hospitals. So we have, and I asked the team to put up this chart. I don't know if you can see it. This gives you an idea of the future first dose based on the Janssen allocation, and you can see that in April we're expecting to get up to 450,000, 475,000, and then by May we plan to bump up over 500,000. So these are the projections based on discussions with the federal government of what they're going to give us, and we've been building the capacity between all our channels. We're very confident that we're going to use all of it.
So that one goes until I can't quite see the very final week. Is that August?
That says August, yes.
Oh, so
Yeah.
if we did 50, well, I guess for that second doses as well, if we did 50,000 a day, if we're at 1.7 million and we have to get to 4.8 million,
Right, that's
we're
right.
at 3.1 left at 50,000 a day, somewhere in the neighborhood of 75 days, we would be able, that theoretically every adult that needed in 60 days, every adult who wants a first dose could get a first dose.
That's correct. Now, of course, then there's the whole issue of access and transportation.
Right.
So we're going to be very aggressive about it, but the issue will no longer be supply. The issue
So that looks like June 1.
Yeah.
Okay.
That's going to move along, and so that's the good news. Now the next step is and we've got the capacity in place with all the channels. What we've got to do, and that's what we're doing now. That's why it's so important to have the local health departments get more, the primary care docs get more, the hospitals. We need them reaching into their networks of patients and pulling them in.
Right. So that, I guess that sort of goes to my last question, that slide, that's that last 70%, 70 to 90% of those 70-year-olds and 80-year-olds.
Yes.
So the strategy there is on the ground calls to pull in the last.
Yes. Yeah. That's it. It's going to be a grind. The 35,000 a week is about 5,000 a day. Our data suggests over the last week or so that that's what it's looking like. And I think Mr. Powell's data supported that also.
Right.
But it's not going to be an easy thing. I mean, we're going to really have to work hard on the ground. We've put this data out to the local health departments so that they know how many that they're looking for. And as you go through this, you can see the numbers that are not vaccinated by jurisdiction. So it's going to be, it's not going to be easy, but we're going to grind it out over the next, weeks.
Right. Okay, great. Well, thank you. Next up, Senator Lamb.
Great, thank you, Mr. President. So my first question has to do with the rising rates that we've been seeing here in the state, and I'm sure, Mr. Schrader, you're aware of this too, that this is the sixth straight day that we've seen 1,000+ cases. Yesterday's positivity rate was 4.99%, very close to the 5% that we've been citing before. There are now 15 jurisdictions that are above 5% positivity itself. And we've even had Dr. Gales, the Montgomery County health officer, said that the increase in cases and hospitalizations isn't getting the attention that it's really due. And this is to quote him, magically, no one is talking about it from the state perspective. Quote, all these increases have happened following the decision to open up more stuff. What is the department doing to address rising positivity? And are there certain benchmarks that the department is monitoring to consider further restrictions or other steps that need to be taken?
Well, a couple of thoughts on that. One is that we're monitoring the age of the people who are, and we're finding that younger people are getting ill, and you know, it's probably natural that younger folks are, you know, as we've opened up, are more likely to be out and about and getting sick. We've been tracking the deaths, which have, you know, been fairly low, and that's a good thing. And the percent of the older population that is getting infected is very low, so 3 to 5%. So what we're looking at is, you know, how is the acceleration? This is a very flat curve, even though, as you say, it has gone up. It's been fairly flat in terms of its growth. So we don't want to overreact. We're monitoring very carefully, but it's generally been the younger population that's been getting sick.
That's true, but the younger population we've seen also ends up infecting the older population, and that's where most of the deaths have been occurring. And I'm concerned that we're reopening faster than we can vaccinate. I guess even just today, the CDC director was quoted that saying she's feeling scared about the future and feels, quote, impending doom. And President Biden had actually also said that just earlier today that he would suggest holding off on further reopening efforts. Would you suggest the same to the governor? And what's the number? Are there specific metrics that need to be met before we can reconsider reopening further?
Well, I would start by saying we were very, even though we reopened, we've been very cautious. We have people wearing masks. We have social distancing is still a requirement. So, you know, as you probably know, even though you might reopen a facility, but if you're doing social distancing, that has a dampening effect on the capacity. So we believe by the reopening, but maintaining masking and social distancing, it's been very prudent. And of course, we're in a race to vaccinate the older population as fast as we possibly can. That's the key to this.
Yeah, I'm concerned that deaths are a lagging indicator. So if we're potentially looking at a spike that we are in now, that it will be late, and any action that would be taken would be late when it comes to the time that we see a rising number of deaths. And so, you know, I'm not hearing specific metrics that you would cite would need to reopen. But my second question then is I know Dr. Redfield's been in the news quite a bit, but is Dr. Redfield, what is he doing for the department as it pertains to the state's COVID response and vaccination program? Is he having any input in this?
He's been advising us on variants and vaccination strategies and surveillance, and we talk with him regularly about that. And you know, obviously, his voice is one. Dr. Chan and her team are still key to this. So, but he has been weighing in on these issues of variants, as well as we talked about.
Okay. Senator Lamb, we have to move on given our condensed time frame today.
Sure.
Thank you, Senator. Senator Washington.
Thank you, Mr. President. Thank you, Acting Secretary. And again, I've learned a lot, with us over the last 11 weeks. I think we've all pushed the needle forward. I think we've raised some good issues and appreciate your responding to our concerns. I want to build on the equity issues that I every week, but I'm expanding that conversation to build on what Senator Lamb talked about in terms of the vaccination rate among our 80-year-olds, 80 plus, 75 plus, who continue to be the majority of the deaths. And I'm asking about a different type of opening, again, this opening up to additional priority groups. And last week, I raised the issue of that it seems like our state was okay with understanding that in some ways, some priority groups are outcompeting other priority groups. In other words, our younger, more affluent individuals are going to be outcompeting our older, less connected individuals, and that's a reality. So I really want to specifically understand in terms of the scope of work that Ernst & Young is doing, what are they saying? How are we specifically addressing that disparity? Like what are they bringing to the table for this piece?
Yeah, we haven't been using Ernst & Young for the equity analysis. We got Steve Hsu and his team, who's a state employee, has been working on the analytics for that. We're doing zip code analysis. So we've been using Ernst & Young more for the operational supply chain and keeping track of how we run our, the mass vac sites. So the equity data is being managed internally, and we're using CRISP data for that as the source data.
Well, Mr. Secretary, that explains a lot then. I'm really disturbed to hear that, what I guess you're characterizing as the premier leader to help move forward, our public health intervention when it comes to distribution, knowing from day one that there are equity problems, that there are disparities problems, there's the access problems, that your main consultant is not part of that process, and that you're adding that very important. Yeah. So I guess I want to make sure. So I heard you say that the issue of equity is not important enough for your primary supply chain person who's educating you about how to do a good distribution, but equity is allocated to internal staff who I'm sure are already doing things. Is that?
No, actually, it's just the opposite.
Do it the other way then.
It's just the opposite. We actually have some very smart people doing the analytics that have been working with us for a while. And the E&Y is not our only consultant. We have a number of people working with us. CRISP, I mentioned earlier, the Chesapeake Regional Information System for Population, has been working the data for us. And we have another analytics expert who's been analyzing, who's got a strong national reputation. So I wanted to say that E&Y is that they're part of our team. They're doing the supply chain analytics, but we feel that it's very important that we focus on the equity data internally, and that's why we have General Burkhead, we have Steve Hsu. And this is too important for us that we wanted to make sure we had a very tight understanding of it, and that's what we've been using them for.
Okay, all right. I was hearing something different, and I think the other issue continues to be, what's the funding situation when it comes to ramping up the vaccination issues? I think it's great that the Baltimore City is ramping up with mobile vaccination units in partnership with Johns Hopkins. Of course, I'm dismayed that this is kind of late, but this is really good. you know, are we engaging MedStar, Healthcare for the Homeless? I raised that again last times about really specifically engaging communities on the ground to do this work.
Absolutely.
From a funding perspective, from a funding perspective.
Right, and so the federally qualified health centers, which Healthcare for the Homeless is one of the 17, we've been using them from the very beginning, probably around mid-January. We were out front on that nationally. We were giving doses to the federally qualified health centers well before. And then of course our Medicaid program provides a lot of resources to that, and Medicaid has been supporting the federally qualified health centers. So we're very happy with our relationship with the community health centers.
And then, Senate President, I just want to clear, because I started with the Ernst & Young, and I would just make sure that the public and all of us understand. So Ernst & Young is the supply chain. So they're working with your relationships with the federal government to help you get more vaccine. Is that what they're doing? I just want to understand what supply chain is. And then who are your equity partners, advisors, externally, not employees, but who are the specialists that know about, really how to ensure that vaccines are getting into the right arms, especially when it comes to people of color and seniors?
Yeah, so we have a physician who is very skilled with data analytics, been working with us for a number of months now. He's deeply involved in this, but we also have our folks at CRISP are really top-notch people. That's our health information exchange. They've been providing data analytics from the very beginning of this, when we were doing testing and helping us figure out the demographics of our targeting.
Right.
So we have, we can, if need be, next week we can bring back some of the other folks, but
yeah,
those are our trusted leaders. Yeah, we
then
can,
just that would be great. And I think what I want back, and again, this is such an important, I'm sorry, this is just so key. It's not enough to simply have someone who can do the analysis. There are individuals who are skilled, have expertise specifically about how to help you understand what you're seeing, how to help you design equity programs and access and community health engagement that work. So I just strongly, as you have contracted out and spend tens of millions of dollars on the supply chain, that in interest of the broader public health of Maryland, that we also invest that type of support and get the support you need to let you know what you're looking at. Thank you so much. Happy to connect you with people that I know that do this work in other states and have been doing it actually in this state. So thank you, Senate President. Thank you very much for that.
Thank you, Senator. Senator Young.
Thank you. I'm going to go two new directions, and I'll ask them both in one question and let you do the talking. But first off, I want to thank you for working with our county exec the way you have, and working on a larger site up in Frederick, and the fact that we also have one out where mostly our African-American and Hispanic people are. So that should help with equity in Frederick. But my two questions, I've seen and read about some medications that are, this is nationwide, but I want to relate it to Maryland, that are sitting on shelves that prevent death. I guess the type of thing that Trump got, or the former president got when he got the COVID. They're saying it's sitting on the shelf and it's not being used. Does that relate to cost or lack of knowledge, or why is that occurring, and is it occurring in Maryland? And then the other question is, there's some discussion starting about passports, using that as a means of controlling who can do what in certain places. In other words, you carry a card that shows you've had the shots, and openings or other things can be handled relating to those. And Are we looking at that, and how do you feel about it?
So on the first question, Senator, monoclonal antibodies are the therapies, and we have been aggressively using those therapies. We are up over 5,000 applications of that therapy, and we've opened up over 20 or 30 sites all around the state. Dr. Howard Haft and Dr. Aaliyah Jones have been leading that for us, and it's been a very effective therapy. So we want to do more. We're pushing to get more. Some of what we found out is that in some clinicians' minds, there's a debate because the association there's one of the clinical associations nationally for infectious diseases was not as supportive of this approach, which is sort of caused it to not be used by some of our clinicians that as we would like. But we have grown that. We've gotten over 12,000 doses delivered to the state, and we've been pushing very hard to get more of these used, and we're up over 5,000 as we speak.
Okay.
Now, getting back to your other question, we haven't gotten in yet to the passport question. There's a lot of debate about that, and we can have that discussion maybe in the next few weeks. We'll bring that back. We're not prepared to have the discussion today.
All right, thanks.
Thank you, Senator. Next up, we have Senator Eckert.
You're on mute.
Thank you. I thought I.
Nope, you're back on mute. Let's try again. There we go.
Am I muted again?
You're good. You're good.
Okay, good. Thank you. Mr. Assistant Secretary, thank you for the mass vaccination sites for Walmart. I've gotten a lot of feedback this week. People like going to Walmart. They think that was a brilliant idea. Not everybody wanted to go to the health department. So it was just a validation that you're right on target with your strategy. My concern is going to be for our vulnerable minority populations. First of all, most of our populations are rural but densely populated at the same time, where groups of people are living together. For many of the populations, I know our National Guard folks are our wonderful team and they're friends to most of us, but not everybody views the uniform in the same way. Just a point. The other one is the GoVax has been inconsistent. And I've had 2 folks on the lower shore for multiple days in a row sign up about 300 people to get their vaccinations. They're about burnout. And here's where the issues are. It has to do with language, with translators, with various dialects. And if one of your major lead translators has a gallbladder attack in the middle of signing people up, you're really down and helpless. It just points up another issue that we've been struggling with, but we're going to need some more ways of really improving our translators. My thought was there's been a brilliant team that went around when we did the census, and I don't know whether somebody can activate those folks again, but they were great because they moved around the state to be able to translate. So I'm just saying that language and dialects continue to be a major issue, and particularly in some of the older population as well as the very young. I think the strategy is best going to the people rather than having them come to us. Just a couple of tidbits to pass on. And I know it's labor intensive to do that, but I just think that building trust is still an important piece of the puzzle in delivering healthcare. But thank you for all that you're doing. I'll continue to keep my eyes and ears out. But most generally, people are very positive. It's just in specific populations that it gets to be a major issue. So thank you.
Thank you, Senator. We'll take that back and evaluate it, and we'll talk to you offline.
That census idea is an interesting idea too.
Yeah.
They just done it. They just did it.
Yeah.
And they were brilliant translators. I worked with translators and met translators for almost every dialect, all my travels around the shore. So I know they're a great team, but we need to grow some more Indigenous people.
That's good. Excellent. All right, Senator Roosevelt, you're going to close this out here.
Thank you very much, Mr. President. I apologize for having just joined like 10 minutes ago. So if I ask something that's already been addressed, just shut me up. My Prince George's question of the day is we don't seem to be getting a lot of progress in getting Prince George's up to the statewide average in terms of folks being vaccinated. Mr. Secretary, you and I have had a conversation offline about this, which I really appreciate, but I want to raise it here in a public setting. When do you think we can get a plan on a piece of paper of how we're going to get the Prince George's numbers up to where they need to be over the next weeks?
Well, since you and I have spoken, we've started today on pulling together a ground game. We're starting to evaluate. There's 35 zip codes in Prince George's, and just like we've been doing in Baltimore, which has actually been pretty successful. I was looking at the Baltimore City numbers today, and there's 27.1% that have had at least one dose, and we're now up to 24.1. So we're closing in on the statewide average for Baltimore City, which is encouraging. I want to use the same approach here in Prince George's County.
Right.
And we're starting to analyze, as you had suggested, each zip code based on the percent. And it ranges dramatically, as you actually pointed out on our call. When you go to Hyattsville, it's down around 10%. In Bowie, it's actually doing much better. They're up in the high 20s, low 30s, even though it's not close to the 40%, it's much better. So there's clearly a difference. And so we're starting that analysis now. And over the next week or so, I want to, each week I want to have a little more to share with you on where we're going.
Great, thank you. Second question comes out of a meeting that I had today with the leadership of the University of Maryland and the leadership of the City of College Park, who've been working very closely together to keep the virus under control in our campus community there. And one of the things that came across from the student leaders, from the city leaders, was the continuing confusion of messages to the public. The CDC is clearer than it used to be, but is not very clear. The president is saying what he's saying. The governor is saying what he's saying. Literally, we walked through for the City of College Park and the campus. What are the rules? Because Prince George's has different rules than the state does. And we had students basically saying, are we supposed to get vaccinated when we can? Or are we not supposed to get vaccinated when we can? Are we supposed to hang back because older people need to get vaccinated? Or should we get vaccinated as soon as we can? And so this was really a plea from community leaders and institutional leaders that as we approach the 27th of April, somehow we together come up with clearer communication about what people should be doing, because right now people remain quite confused about it.
Yeah, we are working with U.S. College Park and the University of System Maryland on. There's a lot of concern about students, particularly since they're going to be leaving to go back from all over the state or all over the country, literally. So we're having those conversations. I will say something that is absolutely clear is that our citizens that are 65 and older will have front of the line privileges. That's got to be our primary focus initially. But there is an argument for college students who are going back home. So we're having that conversation as we speak.
Thank you. Thank you, Mr. President.
Thank you. One final lighthearted question to a degree from a very important constituent of mine has asked for the confirmation that rooftop deck immunity does not exist. Can you confirm that rooftop deck immunity does not exist? There has been quite a expansion of rooftop deck parties. And so I worry about the positivity rate associated as such. I assume that's a yes.
Yes.
Look, we are, it's just about 4:45, so we have to cut a bit early. We will see you shortly, Mr. Acting Secretary. Thank you. Look, this is an important week, and we really look forward to seeing that distribution system in full working gear and seeing those 50,000 a day. So thank you very much. And we will see you for our final meeting next week.
Yep, thank you, Mr. President. We look forward to it.
Wonderful. Thank you. Take care.
Take care.